Now, some of the symptoms associated with IBS, for the most part, gut pain. So you may experience direct pain, and the pain actually comes as a result of this, right? Because this creates distension, and that distension is what causes the pain. It activates the pain as that distension occurs. Now, again, constipation, this is a major problem here. Constipation is a really big problem for a lot of folks, and one of the reasons why is it creates, it leaves your poop in you. So if we're going to draw you a picture here, this is the gut, okay? So the cells of the gut look something like this. There's a single layer of cells. Okay, so imagine this is the tube of the gut. So food is coming this way. If your mouth is, up here, right? And so that the food is coming through and going through the gut lumen. So right in between your gut cells, you have these anchors called tight junctions. This is what I'm drawing in red here. These are tight junctions. They keep the lining of your GI tract sealed really tightly. Let's erase a few of these here. And so what then happens is when you have the poop, let's just say, your poop is sitting right here and it's stuck, right? Because here is where you get a contraction. So this poop is kind of being lodged. So everything here, that poop is just kind of sitting there. And so all the little bacteria, all the little microorganisms that live inside of your GI tract, remember, you've got trillions of these guys, they will start acting on that poop. They'll start, and it's poop plus food, right? So it's not just poop, but it's basically, it's the bolus that your body is basically trying to extrapolate the good and poop out the bad, but the bad is staying stuck because you've got this this abnormal physical bowel function where you've got spasmodic bowels. And so as it backs up, it sits here, right? And as it produces byproducts, some of these byproducts can damage the gut, right? So in essence, as they're damaging the gut, that creates leaks or gaps in between the cells. And so then you get that scenario of leaky gut. And this is actually what they're learning. In a number of research studies, they're actually finding that this is what happens with IBS, is that IBS, initially can trigger damage to the cells of the GI tract, creating kind of low levels of inflammation, leading to leaky gut. Remember that the largest part of your immune system, about 70% of your immune system, is called the GALT. That stands for gastro-associated lymphoid tissue. It sits right behind your intestinal lining. So it's like a big set of tonsils that wraps around your intestine. And so now all the toxic byproducts of that food that's not breaking down, and the bacteria as well, they're leaking into your immune system. And so what does that do? It engages your immune system, turns it up, it ramps it way up. And so now you have antibodies and other things that are starting to be produced. You have other cytokines and toxic chemicals that can create damage in an effort to try to neutralize that toxic byproduct. And this makes people even sicker. So a lot of times, my point is a lot of times as the leaky gut occur, or as the IBS, the irritable bowel contraction occurs, blocking the passage of stool, that stool sits here for a lot longer and it marinates inside of you, and then it starts leaking through, activating and engaging the immune system. And so oftentimes what will happen, beyond this, what happens when your immune system is overengaged? You develop autoimmune disease. This is the big issue. And so again, IBS is generally like a precursor to bigger things coming, and that's because of this leaky gut mechanism. But the distension being caused behind the muscle contraction in the small intestine, leading to a leakage of toxic byproducts. And then your gut will eventually try to break through that distension, and it will. So the constipation, again, it occurs first, creates the bloating and gas, the distension through the pain, and then your bowels will flush it out. And that's why, generally speaking, IBS is intermittent. It's not always constipation, and it's not always diarrhea, generally speaking. Now, sometimes it can be. There are people I've seen that they'll have constipation. They actually have to do their own enemas or their own glycerin suppositories, or they have to do certain things like take extra vitamin C, extra magnesium, or certain types of like cleansing teas to actually have a regular bowel movement. And that's not normal. So again, that constipation side, or that IBS type C, in my experience, is usually more so related to that that sympathetic nervous system dominance, where the nervous system is just so stressed and so high strung that the bowels just won't go, and that's where that constipation can come in. Whereas the diarrhea is a mixture of this happening, but it's also, the diarrhea is, remember what the word is, irritable bowel syndrome. So the big question that we ask is, what is creating the irritation? This is a question when you go to a GI doctor, they love to throw this diagnosis at people. You have IBS-D, you have IBS-C. Okay, doc, if I have an irritable bowel, the number one question I can ask and get an answer is, if my bowel's irritated, the question is, why is it irritated and what's irritating it, right? So this is the $1 million question, and if that question's not being asked, then you're going to miss the whole point. There's always got to be something. If we're talking about an irritated bowel, something's irritating the bowel. So what are those things that can irritate the bowel? Well, one of those things that can irritate the bowel is bacterial imbalance. Okay, so not having the right types of bacteria. So how could this happen? How could the bowels be irritated by an imbalance in the type of flora? Well, one of the big ways, let's change colors again, is through the chronicity of antibiotic use. Okay, another way would be antacids. These are drugs that commonly alter, the antacids alter the pH. Let me do that right. I did it wrong twice, sorry. pH, power of hydrogen, and the antibiotics alter the bacteria. They alter the milieu, the types of bacteria. Oftentimes what antibiotics do is they lead to yeast overgrowth. And that yeast overgrowth, yeast are methane producers, so they'll actually start, more yeast in the bowels will start to increase methane gas formation. That methane gas oftentimes leads to perceived SIBO. It's, you know, if you're, well, we won't get into SIBO tonight. But methane gas, it's a can create bloating and distension and pain. And then, you know, so subsequently, these two things are things that can create irritation, right? So again, if we're talking about an irritable bowel, what's irritating? Sometimes the medications that you're on. Now, sometimes you'll go to the doctor and you're already irritated, and these are things they'll give you to try to treat the irritation, and then they can oftentimes make the irritation worse. Again, antibiotics, number one cause of a yeast overgrowth. Yeast overgrowth in the bowels are one of the things that can cause imbalance in the way the bowels move and work. And antacids, because of their disruption of the pH in the stomach, that can lead to inability to properly digest the protein. So now when the protein's coming down into the small intestine, it's not properly digested, and that leads to fermentation. So that protein from the meat or from the food that you're eating, that protein, because again, the alteration of the pH, it's not digested, so it ferments. And so now when you have fermenting protein, what does that do? It produces gas. And this food that's fermenting, this is in actuality, it's rotting. So it's not even that it's just fermenting, but it's putrefying, it's rotting. So it's forming byproducts and gases and other things that actually change the milieu of the bacterial environment. And so a lot of times what I'll see in people is they've got a history of popping, you know, antacids because they want to eat bad, so they just take an antacid before they eat bad, and then over time it leads to this process, right? And then now they have a much bigger problem on their hand. So there's other things that can create irritation as well. So one research study that I'm actually, this diagram was created from a research study, found that the gluten-free diet reduced diarrhea in patients with IBS. So if you struggle with the diarrhea aspect, that a gluten-free diet was extremely effective at reducing that diarrhea. We also know that going gluten-free causes a noticeable and measurable increase, or reduction in leaky gut in those eating gluten. So in essence, these authors of this study say noticeable and measurable increase in leaky gut in those eating gluten, meaning gluten causes leaky gut. So going back to what we just showed you here, which is you got the irritable bowel, you've got the potential for the bowels to, the muscular contraction to prevent movements from passing through. We've got potential for gluten exposure creating leaky gut. Now the poop's leaking into the bloodstream. The toxic byproducts are leaking into the bloodstream, again, setting the stage for autoimmune disease. So we know gluten causes leaky gut thanks to the work of Dr. Alessio Fasano. We know that gluten causes an increase in inflammation within the gut itself, and that inflammation can contribute to leaky gut. Again, another mechanism of leaky gut. We also know that everything was worse in patients who had positive gene markers for gluten. Okay, and this is why you hear me harp about this a lot. If you've watched my master class, I talk a lot about the genetic markers of gluten sensitivity and why blood tests aren't super accurate. Blood tests are misleading, and they can lead to people thinking that gluten is okay, and when it's not. And this is, again, these researchers found that those with positive genetic markers for gluten sensitivity, when they went gluten-free, they had reduced IBS symptoms in the form of diarrhea. There was measurable improvement in leaky gut, but also measurable improvement in inflammatory markers. So we know gluten is a major player as the irritant, right? So we're asking in IBS, what contributes to the irritation? What causes the irritation in the first place? We know gluten definitely can, okay? And so gluten is one of the big ones. It's one of, in my experience, 20 years of practice, this is one of, probably arguably one of the biggest factors in IBS. The issue here is most people go gluten-free the wrong way. They do the diet wrong. As a matter of fact, 92% of people going gluten-free fail to receive improvement because they do the diet wrong. And if this is the first time you're hearing it, you definitely need to check out No Grain, No Pain. Now, again, there are certain medications that can lead to IBS, particularly antibiotics and acids. Certainly, there are other medications that can damage the ability to digest and process food, like nonsteroidal anti-inflammatories and other medicines, but we're not going to get into all that tonight. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.